Most problematic data are sometimes the repertories, because in the repertories we don't have any references. We don't know where the data in the repertories come from. The rubrics are getting too big in the modern repertories, and especially the polycrest.
Almost nobody is happy with repertories we have. So what is the solution?
Perhaps the solution is to do a new repertory from scratch.
Hello, dear friends, homeopaths. This is Barbara Liberowicz from Homeo Sapiens. My guest today is Dr. Rainer Schafferkort from Hamburg, Germany.
Thank you very much for the invitation.
Okay, can you please introduce yourself?
Yes, I'm a psychiatrist from Hamburg in Germany, and I'm engaged in what I call data analysis of materia medica data and patient data for 15 years, I think. And one of the results of this analysis is a new repertory, and I'm glad to talk about it a little bit today, and to introduce my repertory and to talk a little bit about the problems of many repertories today.
At Homeopathic Legal Congress in Utrecht in May, you presented there your lecture about data mining. What do you exactly mean by data mining?
Yes, data mining is an approach which is very common nowadays, which means you have a bunch of data and you explore it with statistical methods. And in homeopathy, we have a lot of data. We have the materia medica data. It's often very problematic to gather new data from patients in a good way. But materia medica, it is there. We have a lot of data, which is sometimes 200 years old or older, but we have a lot of it. We have 20,000 pages, book pages of materia medica data. And with the techniques we have today, statistical techniques, database techniques, we have a good opportunity to explore this data, to do research on this data.
What do you think about the quality of data we have today, and where can we search for the right data?
I think the most problematic data are sometimes the repertories, because in the repertories we don't have any references. We don't know where the data in the repertories come from, especially in the old repertories, Kent, Boga, Bönninghausen, and so on. And the materia medica data, we have sometimes very good references. We know what Hahnemann did. We know how Hahnemann conducted his provings. We have references to poisonings and also to clinical cases. I think the materia medica isn't that bad.
I remember during your lecture in Utrecht, you gave us live examples. As I understand, you make a research on some neuro symptoms and you were gathering data from real life. And then you compared it with the repertories, old repertories and the new ones.
Yes, I compared two different kinds of data. The first one was materia medica data. The second one was prognostic factor research, that's clinical data, prognostic clinical data. The third one was Kent's repertory, and the fourth one was the complete repertory. And the materia medica and the clinical data, they compared very well. Kent repertory a bit worse, but the worst one of all was the complete repertory, that's right. And I think the reason for this is that the Kent repertory was based on clinical experience. They wrote down what they experienced, what they knew from the materia medica, and what they experienced from their own clinics. And the complete repertory is built on a selective analysis of data, of materia medica, of published cases. The statistical approach in the complete repertory is out of date. That's the problem.
While repertorizing, the problem appears that there are too many polycrests appearing in the results of repertorization. And what I do now, almost always, I search for smaller remedies, so-called smaller remedies. We have remedies that are often used and less often used.
The small remedies, it's okay, but you also have to look for small rubrics. The rubrics are getting too big in the modern repertories, and especially the polycrests are upgraded, and they're all there in the third or fourth grade. And that's the problem. You can't use these big rubrics anymore.
Almost nobody is happy with repertories we have. So what is the solution?
Perhaps the solution is to do a new repertory from scratch, to discard the old repertories and to begin from the very start. And that's what I did. I built a new repertory which is solely founded on Materia Medica, not on other repertories, not on clinical experience, but solely on Materia Medica. That's what I did. And there are three main features in the repertory. First one is the Materia Medica Foundation. Second one is it has no rubrics, but it has phenomena. That's why I call it phenomena. And the third one is it is based on Bayesian theory, Bayesian statistics. That are the three key features. And with these, I could build a very new and very reliable and very transparent repertory where you can see all the symptoms of the Materia Medica in each rubric.
You know, the funny thing is it starts raining here.
So you have the same weather as we in Hamburg.